Sherry, I'm Kelly. I'm your nurse. We'll
Hi.
walk in here. We're just going to do your physical assessment. I'll have you sit on the bed and I'm just going to wash my hands here, and then I'll pull the curtain back for privacy.
Okay.
Okay, I'll just pull this down here. Can you just state your name and date of birth for me?
Sherry Clark Garcia, 2/18/1968.
Okay, and you know where you're at?
Penn Highlands, Clearfield.
Do you know the year?
2018.
And do you know why you're here?
Well check.
Good. The patient is alert and oriented. She is answering appropriately. No distress was noted. As we saw when she walked in, gait was steady. Her skin color is white. She's a female. She does have freckles noticeable, and her facial expressions are matching her mood. She's calm, cooperative, and appropriately. Posture is erect and symmetrical, and there's no physical deformalities noticed. Dresses appropriately. Personal hygiene is well kept, and she is not dirty or messy. Sherry, I'm going to have you walk over here and we're just going to get your weight. You feel okay standing?
Yep.
And the weight is 128. Okay, go ahead and step out and I'll see where the number is. It's 157 centimeters. Says 5'1.5". I'll just have you sit back down, Sherry, and we'll just give vitals here. Doesn't matter.
Sorry.
Outside. That's okay. Oh, you have. I'll just hook up the blood pressure cuff. Is it okay to use your left arm? And oxygen on room air is 97%. Heart rate on the monitor is 75. I will also assess her pulse, her rhythm, and force. Blood pressure is 100/60. Do you usually run on the lower side?
I do.
Okay, you just gotta see your wrist. Just get your pulse here. Okay, for the pulse, it was normal 4s and regular rhythm. I got 74, and I was also counting the respirations, which is unlabored on room air, and I got 16. I'm just going to get your temperature here, Sherry.
Okay.
Please place this under your tongue. Okay, she's 36.5 and 97.8 Fahrenheit. Okay, I'm just gonna assess your skin here. Patient is warm to touch, no cool extremities. Capillary refill is less than 3 seconds. her nails. There's no clubbing present. There's a slight contour on the posterior and lateral sides. No hangnails. Nails are well groomed. She has noticeable freckles. She is on the paler side. She's usually pale. There's no edema of the legs. She is a younger female, so she shaved her legs and hair is well distributed. I'm just going to get a pair of gloves and check your hair on your head. Just going to feel your scalp here. Hair is evenly distributed. Hair is blonde. There's no infestation in it. She is clean. I also felt the skull in between, and it was normal size. There was no bumps or irregular shapes of the skull. I'm just going to pitch my gloves in. Use hand sanitizer. I'm just going to check your temporomandibular joint, which is on the side. Okay. And just let me know if you're having any pain or tenderness in that field. Okay. I'm just going to have you open up your jaw and close and move your jaw side to side. Okay. Any pain?
No.
No. There's no clicks in the jaw, and it was a smooth opening of the mouth and smoothing of when she slid her mouth. I'm going to just palpate your neck now, just to see if there's any enlargement. Muscles are symmetrical. I didn't notice any enlargement of the parotid salivary glands or the thyroid gland. Sherry, I'm going to have you touch your chin to your chest. Okay. Any pain or stiffness?
No.
Okay. I'm going to have you turn your head to the right side and again to the left side. And I'm going to have you touch your right ear to your right shoulder. And the same one with your left side. Okay, and then just put your head back. Okay, I don't see any enlargements, like I said, of the salivary glands, parotid, or the thyroid. And I'm just going to fill your thyroid here, just be on the back side of you. Okay, the thyroid is not enlarged. And her trachea is midline, as we saw. And I'm just going to fill your lymph nodes now, which I'm just going to go circle motions from the side and down.
Okay.
Any pain or tenderness?
No.
Any pain?
No.
No. Okay. And I'm just going to check your turgor here, which turgor is normal. Okay, Sherry, I'm just going to check your eyes now. So we're going to use this Snellen chart over here. I'm going to have you stand and walk over here. And where this blue tape is 20 feet away. Okay, Sherry, I'm just going to have you cover your right eye with a card and just please tell me how far the lowest line that you can read.
Number 8. D-E-F-P-O-T-E-Z.
Okay. Good. And we'll do the same thing with the cover the left eye and just tell me how low you can read.
Number 8. D-E-F-P-O-T-E-C.
Yep. Okay, as we saw, she was able to read down to line 8, which is 20 feet away, which is passing, so she was 20/20 vision. Okay, Sherry, we'll just go ahead and sit back in the bed here. And I'm just going to use the eye light just to check the reaction. Okay, I'm just going to dim the lights a little bit here. Okay, pupils are equal and reactive to the light. When resting here without shining the light in her eyes, they were 3 mm, and when constricted, they were 1 mm. And then, okay, and I'm just gonna bring my finger in and just follow. And she passes the accommodation, so she, with the acronym, is PERLA. Sherry, I'm just gonna, with your eyes again, check the confrontation. So we're gonna use the note card, and you cover your right eye, and I'll cover my left eye. I'm gonna wiggle a finger, and when you see it come in the line of direction, just say now. Okay, we're just gonna do it the same with your left eye then. Okay. Hey Sherry, I'm just gonna check the 6 cardinals of gaze just to see if you have any muscle weakness in your eyes. So just follow my finger and just don't move your head or anything, just with your eyes. Okay, there is no muscle weakness noted. As I'm looking at her face, it is symmetric. Eyebrows are symmetrical. The pupils, like I said, are equal. There's no swelling of her eyes or redness. And then I'm just going to put gloves on just to pull down your eyes. Okay. Just. Okay, and I'm just going to put my thumbs to the lower part of your eye here, just to see if they're moist and glossy. Go ahead and look up. Okay, eyes are moist and glossy, no dryness noted. Was there any pain when I pressed there? No. No pain, okay. Just let me wash my hands here, please. Now pull out your eyelashes for the eversion, just to check underneath your eyelid there. And so I just pull out your eyelashes, put them on top of a Q-tip just to look under, okay?
Okay.
I'm just gonna move your hair a little bit. Okay, skin color matches, and I didn't see any foreign body. I'll go ahead and use this side here. Okay, and same with the right eye. I'm just going to discard this and wash my hands. Okay, next I'm just going to use the ophthalmoscope just to check your eyes here for the vessels. I'm going to take my glasses off. Okay, Sherry, I'm just going to look into your eyes here and just stare ahead here. And there's going to be a bright light, so just warning you now. Okay, the artery was brighter than the vein. Ocular fundus was like a pink, orangey, yellow. I'm just going to do the same with the other eye. And it is also noted the same exact thing on her right eye there. Okay, and the optic disc was noted as round and creamy, and the fundus was clear. So now I'm just going to check your ears here, Sherry. You can go ahead and put your glasses on if you wish. Okay, I'm just going to check this ear here, Sherry. Alright, and just compare it to your other one. And they're equal bilaterally. The skin color matches the face. They are pale. There's no redness. There's no swelling. There's no warmth. Sherry, I'm just going to check to see if you're having any pain here. Any pain when I move and press?
No.
No. I'll just do the same on this side. Okay, on this side?
No pain.
Okay. Now I'm just going to look into your ear here with the otoscope. some cerebrum is noticed. It's just the honey looking, and then the tympanic membrane is shiny and gray. Same on this side, a little cerebrum notice, and tympanic membrane is also shiny. Okay, when I was looking into her ear as well, the tympanic membrane was also translucent. So Sherry, I'm just going to do the whisper test. I'm going to be behind you, repeat 3 letters and a number, and you just repeat back to what I'm saying, okay?
Okay. 5K.
Okay, and she passed with that ear, so I'm going to move on to your left ear, Sherry, and do the same thing but use a different combination.
7A2.
Okay, and she also passed on the left ear. And we do not have any tuning forks available. What I would do for the Ryan and Weber was strike it and just press back here to see if she can just tell me when it stops vibrating, and also on the other side, and also strike it again and just stick it on top of her forehead. Her head, not the forehead. Okay, when I said about the striking it on the middle of her head here, we were testing to see what ear she hears it best from, either the right or the left or both. Okay, Sherry, now I'm just going to look at your nose. As we see here, the nose is symmetric and in proportion with the rest of her face. It is the same color, no redness, there is no drainage noted or any dryness. And so Sherry, I'm just going to look up your nose with the otoscope again. Before I do that, I'm just going to press your nasal and just sniff you every time I do. Okay, go ahead and sniff. Okay. Okay, there's no blockage in there, so I'm just going to take a look. I'm just going to look up here. Just stick this in here. Okay, and other side. Okay. Oh, lordy. Okay, and the nasal mucosa was moist and red in both nasal cavities. There's no drainage, bleeding noted. Midline and inferior turbinates were also the same on this side. There's no polyps as well. And the turbinates were also the same light red as noted. So Sherry, I'm just going to test your sinuses up here and down here. Just tell me if you're having any tenderness or pain when I do it, okay?
Okay.
Any pain?
No.
Okay. And they were not swollen or tender, as she stated there. Okay. Okay, Sherry, I'm just going to get gloves and we're going to check your mouth area.
Okay.
Her lips are dry. They are not cracked. They are moist. And I'm just going to look inside her mouth here as well. I'm just going to grab the tongue compressor over here, my gauze. Okay, Sherry, I'm just going to have you open up your mouth. Okay, so teeth are white and straight and they are clean. Just go ahead and close your mouth with the, like this. Okay, there's no overbite noted. I'm just going to grab your tongue, Sherry, with this gauze. Okay. I'm just going to have you stick out your tongue here, and I'm just going to grab it just so I can see the sides. And the sides look healthy. There's no lesions. There's no white spots. Okay. And I'm just going to look at your cheek. Okay. I'm just going to put the tongue compressor over here. Okay. There's no lesions or open areas, and the cheek is pink and moist. And the same goes for the other side, and since she has her tongue up in the air, the underneath surface is also moist, no cracks, no open sores, and the veins were noted. I'm just going to have you stick your tongue out and say, ah, Sherry. Ah. Okay, the uvula raises, the hard palate is noticed, and Okay, Sherry, I'm just gonna check your thoracic area here. So I'm just gonna point out where some important spots are on your chest area. So the suprasternal notch is up in here, and I can feel it, and her angle of Louis is down there, and I can also feel, and I'm just gonna feel her C7, and that's just the notch back here, and it is present, not enlarged. Okay, and then while I'm back here, I'm just gonna palpate your chest wall expansion here, Sherry, and as we can see, her respirations are unlabored, regular, and even. So I'm just gonna pinch back here. Okay, and go ahead and take a deep breath. Okay, and both fields moved equally here, and I'm just okay, Sherry. And since I'm behind you, I'm just gonna check for your costovertebral angle to see if you have any tenderness there. So I'm just gonna place my hand back here under the 12th intercostal, and I'm just gonna thump here and tell me if you're having any pain. Any pain?
Nope.
Let me get on this side.
Nope.
Okay. Alright, I'm just gonna palpate your lung field, so I'm just gonna have you say 99, and I'm just gonna see if the vibrations are felt equally. Okay, go ahead and go.
99, 99, 99, 99, 99, 99, 99.
Okay, and they were all felt equally. Okay, Sherry, I'm just gonna take a listen to your lung fields here. So I'm just gonna have you deep breathe, please. And out. Last one. Good, okay. Now I'm just gonna listen to the front side real quick, Sherry. So far they're sounding clear and equal bilaterally. And resonance noted. Okay, go ahead and go. Okay, and last one over here. Good. And continues to be equal. Okay. Okay, Sherry, I'm just gonna listen to your apical heart rate, which is down and below this sternal notch and xiphoid process, and it's just over here.
Okay.
Okay, for 30 seconds it was a regular rhythm, no pulse deficit. And I'm just gonna listen to your carotid here just to see if there's a brewery. So I gotta flip it over. Just get the front side here. No breweries are noted. Okay. Okay. I'm just gonna put my glasses back on finally. And then I'm just gonna inspect your skin, Sherry, and just your vascular and lymphatic blood flow here. So I'm just gonna feel for your artery up here. Regular rhythm, force is normal. Regular rhythm, force is normal. I'm just gonna check the popliteal arteries. And the force is normal and rhythm regular. Force normal, rhythm regular, and then just your pedal pulses here. Force normal, regular rhythm. And same with the right foot force. Force normal and regular rhythm. As I'm squeezing as well, there is no edema noted. Again, like I said, no edema noted of the arms. Both warm, dry extremities. No lesions or abrasions noted. Okay, Sherry, I'm just gonna check just your vascular of your foot here. So I'm just gonna take off your sock. Okay, and veins are noted. There's nothing noticeable. There's no lesions, and the capillary refill is also less than 3 seconds. I'm just gonna check your other foot here.
Okay.
And same goes for the left leg here. And nails are well kept. Okay, Sherry, I'm just going to check for the Homan sign. This just proves it, see if you have a blood clot or not. So I'm going to have you lay down in bed here, and I'm just going to clean my hands. And I'm just going to support your thigh and just have your knees slightly flex, and I'm just going to have you dorsiflex your foot, so that just brings your foot back. We'll use your left leg, okay? And slightly bend the knee a little bit, and go ahead and dorsiflex.
That's my right leg.
Your right leg. Okay. Any pain?
No.
Okay, so that one's negative. I'm going to come over here for your left leg now and do the same thing. Okay, and go ahead and bend a little bit. Any pain?
No.
Okay, so she is negative for the Homan sign. Now I'll just have you continue to sit there because I'm going to check out your abdomen here.
Okay.
I'm just going to put your head flat just so I can see the contour and the symmetric of your belly here. Are you getting dizzy as I put you down?
No.
And a little quasi when I'm done here. Okay. So the contour is flat. I'm just going to get it highlighted again. There's different lights here. And the belly is symmetric, and just some pulsation is noted. So Sherry, I'm just going to take a listen to your belly. While you're flat, I'll just listen. Bowel sounds are present in all 4 quadrants. Okay, Sherry, I'm just gonna percuss on your belly and just to see if you have any dullness noted or hyperresonance. Normal is resonance. Okay, resonance was heard. There was no dullness or hyperresonance, and then I'm going to palpate now and just tell me if you're having any pain, okay? Just lightly. Any pain? Okay. Okay. And then I'll Sherry. And I just did the light one. I'm just going to do deep now, and I just press a little bit harder. Is there any pain?
No.
No pain. And I also didn't feel any enlargement, and as you saw with her facial expression, she was not guarding, and she was not ticklish, and she acted appropriately for me palpating the abdomen here. When I pressed up in your right upper quadrant, were you having any pain elsewhere?
No.
No pain at all?
No.
Okay. And then there was no enlargement, like I said, and with her facial expression, she didn't grimace. When I was palpating the belly, she didn't move her arms and hold her belly. Okay, Sherry, I'm just going to palpate your liver, spleen, kidneys, and aorta now, just to make sure there's no enlargement. So I'm just going to put my hand over here, and just press and go ahead and breathe. Okay, any pain when I was pressing?
No.
Okay, and no enlargement was noticed. I'm just going to come over on this side a little bit and check for your spleen. Okay, go ahead and go. And breathe. Any pain there?
No.
No, the spleen was not enlarged. Since I'm on this side, I'll just do the left kidney here. And just go ahead and breathe again. Okay, smooth mass you can feel move through with my fingers, and I'm just going to do the same thing on your right side. Okay, again, Sherry. Okay, and the same was noted on the right side, just a little less, and then I'm just going to feel for the aorta. Which I can notice right there. Okay, when I palpated for the aorta, there was no aneurysm noted. It wasn't enlarged. And was there any pain when I pressed Sherry?
No, it wasn't.
Okay, Sherry, I'm just going to check the Murphy sign just to see if you have any pain to clue us if you have any appendicitis. So I'm just going to press over here. Go ahead and deep breathe. Any pain?
No.
Okay. And just down here again. Any pain?
No.
Okay, so that test is negative. Okay, Sherry, I'm just also going to check the iliopsoas test. So I'm just going to have you lift up your leg and I'm going to press down. Any pain when I'm doing that?
No.
No. Okay, so that is also negative, and so right now she doesn't have any clues for appendicitis. Sherry, and also just to rule out anything for appendicitis, I'm just going to lift up your right leg and we're going to bend it slightly inwards, and I'll help support the ankle, and just tell me if you're having any pain, okay? Okay. Any pain?
No.
Okay, so that is also negative. Okay, Sherry, I'll raise up your head here now just a little bit, and I'm just going to inspect your joints, just to look at the shape, contour, and then we'll also do some range of motion actions here. It's right there, okay?
That's good.
Okay. So I'm just going to see your arm. So contour, the size of the muscle is normal for her age, and you can see the contour there. And same with her calves, there's no bulging muscle or deformities. And then we're just going to do some range of motion action, Sherry. The best way to actually do it, we'll just lean our legs over the side.
Okay.
Just so I can see your extension, flexion, abduction here. Okay, so I'm just going to have you stick out your arms for extension, and then go ahead and flex. Good. And then arms down again, and then out for abduction, and then back down for adduction. Good. And then for your ankle, I'm going to have you do inversion and eversion. So go ahead and just in and out. Okay, and then same with your left one there. Good, okay. And then your hands, I'm just going to do prone and supine here. So that's prone and then go up. Good, okay. Any clicking, pain?
No.
During that? No. Okay, Sherry, and we're just going to do the Phelan sign. So just go ahead and press your hands at a 90-degree angle like this. Any pain noted?
No.
Tenderness? No.
Mm-mm.
Okay, and then I'm just gonna, for the Tyndall sign, just percuss on this side here. Any pain?
No.
No. Any pain, numbness, or anything like that?
No.
No. Okay. Okay, Sherry, I'm just gonna check your shoulders here and just feel. So contour and shape is normal. No bulging of any muscle. No heat is present. Any pain when I'm pressing?
No.
No. Okay. And then I'm just gonna have you shrug and up and down. Okay. Any pain?
No.
Okay. Go ahead and do it again. Okay. No crevices felt. And then as I'm pressing down, try to push up, Sherry. Good. Okay. And she does have shoulder strength there. Okay, Sherry. And I'm just gonna check your spine here. So I just need you to stand. And I'll make sure your backside's covered, and I just gotta see the backside. So I'm gonna come over here. Okay. And as you can see, the spine is midline. There is no scoliosis or lordosis or kyphosis noted. I'm just going to feel any pain when I'm going down your spine, Sherry?
No.
No. Okay, and I don't notice any swelling of any muscles or anything. I'll have you go ahead and sit down again, Sherry. Okay, Sherry, and I'm just going to check your elbows now. As you can see, there's no redness, warmth, there's no dryness. The same goes with the other side. And then I'm just going to hold your arm a little bit. And there's no swelling of the synovial joint. Same with this one. Go ahead and bend. Any pain?
No.
Okay, and bend out. smooth transition from flexion and extension there. Okay, good. And then I'm just gonna check your wrists and hands at the same time here. So just gonna palpate your hand. Good, and just there's some slight extension there, and you can notice the muscles. It is rounded there by the thumb and here. There's no warmth or swelling on both of the hands, and you can see here as well. And then I'm just gonna check out your fingers and knuckles. Any pain, tenderness?
No.
Okay. No bulging of any knuckles. And they're equally. No deformities noticed, and any pain or tenderness. Okay, and like I said, the skin is warm and dry, and there's no lesions or dryness of the hands. When she was standing, I saw that her hips were aligned, iliocrest was noted. There was no deformities of the lengths of her legs. So Sherry, I'm just gonna have you sit down after I check out your knees and ankles, and then I'll just check out your hips just a little bit more. Any pain in your knee?
No.
Okay, can you extend out and flex down? Any pain?
No.
Do it again. I'm just gonna feel. No crepitus was noted, and no swelling. There's no warmth. I'm just gonna lift just a little bit to see if there's any redness. And there's no redness, no abrasions. And then your ankle. I'm gonna have you flex and. Good. Okay, now I don't feel any crepitus. Any pain?
No.
Okay. Awesome. Good, okay. And then we tested the range of motion earlier, and then just feel your toe knuckles. Any pain?
No.
Okay. Any pain?
No.
Okay. And I'll have you lay down. I'm just gonna check out your Sherry. Okay, Sherry. I'm just gonna check for your hips here. And just feel on the side. Any pain when I'm pressing?
No.
No pain. Okay, and they are symmetrical on both sides. No tenderness. And did it hurt when getting into the bed, like bending at your
No.
hip? No hip pain. Okay. Okay, so they were stable and symmetrical, like I said earlier. Mental status, like I said earlier, she's alert and oriented ×4, and I'm just gonna test the cranial nerve number 5, Sherry. So I just gotta test the motor function, and it just checks out your face muscles here, and then cotton ball later. I'll just leave them there. Okay, and I'm just gonna have you clench your jaw, okay, and muscles are felt evenly there. And Sherry, I'm gonna tap you 3 spots on your head. I'll have your eyes closed and just tell me when you feel them. Okay? Go ahead and close.
No. 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 No.
Okay, and cranial nerve number 5 is intact. Okay, Sherry. Most of the tests we've already done so far tested the previous cranial nerve, so we're kind of like going back and forth with different numbers, but not in order. And the last one I have to do is just cranial number 6, which is just a facial one. And this one I'm just gonna have you like move your eyebrows, puff out your cheeks, and everything. So go ahead and raise your eyebrows. Go ahead and frown. Okay. Go ahead and show your teeth. Okay, and then sad face. And then go ahead and puff out your cheeks. Okay, so she passes that. I'm gonna check your reflexes, so I'm just gonna have you sit on the side again. I'm making you go up, down, up, down, up, down. So I'm just gonna check your bicep reflex here. So I'm just gonna support your arm here. Just have your arm bent like this a little bit for the tricep. Okay. And break your radialis. Okay. I should probably do them on both, so we'll do it down here as well. And then just your knees here. I'm gonna have you relax. Okay. And then just your Achilles down here. so all reflexes were normal and average. There was no over protruding, and she was able to feel all of them. Okay, Sherry, I'm just gonna check your strength here of your hands, arms, and legs and feet. So I'm just gonna have you squeeze my fingers. Good, and go ahead and stick out your arms out straight and just try to push against. Good, and then same with your legs. Go ahead and try to lift up. Good, and then and just go ahead and push down. Good, good. So she does have muscle strength. No weakness was noted, and there was no tremors with anything that you did as well. Okay, Sherry, and I'm just gonna check your Babinski one. So of course we gotta lay back down here. I'm just gonna take off your socks here. Just let me clean this. And they fanned out, they did not curl in, so she has no irregularities of the Babinski. Okay, Sherry, I'll put your socks back on and I'll clean my hands since I'm going to touch your hand area. I'm just going to check to see if you have any tremors. I'm just going to have you put your finger to my finger out, and then go ahead with your other one out, and just hold out your hands steady. And as you can see, there's no shaking or tremors noticed. And Sherry, we're going to do the Romberg test, so I'm going to have you stand back out. This is the last test. Okay, and stand there for us, feet side by side. I'm going to have you just close your eyes for 20 seconds to see if you get any dizziness. Okay, you can open up your eyes, Sherry. Did you feel dizzy or anything? I didn't notice you swaying back and forth just a little bit at the beginning, but you caught yourself. And then I'm also going to have you stand side by side one more time. And go ahead and,
the hole in these socks, that's why.
I'm going to have you just bend your right knee. Good, okay, and go ahead and put it down. And go ahead and bend your left knee. Good. Okay, and Romberg test was completed. She did not fail the test. And then, Sherry, you can go ahead and sit back down. You can change back into your clothes, and this concludes our physical assessment.
Thank you.
Okay, for this self-breast examination, we don't have to do it for the assessment, but I just need to teach Sherry what she needs to do at home. The self-breast examination is best doing it when after your menstrual cycle, about day 4 through 7 of your cycle, since the breast will be less tender and less concentrated, full of pressurized. For Sherry, though, since she had a hysterectomy, we'll do it at the first of every month, just so it's a monthly reminder that she does this. And she can do it either in the shower with the soapy water to help with the palpitation, or she can do it while she's laying down in bed. For the technique, she will use an up and down pattern and just use the 3 fingers and do it in a circular motion going through the breast. And then she'll use 3 different levels of pressure just to see if there's any lumps or bumps. And once she's done doing the assessment with the breast, she can then sit up, or also in the shower just raise her arm slightly just to check for the underneath of her arm. And then while she's looking in the mirror after the shower, or when she's done doing the breast examination, she can also look in the mirror and put her hands on her hips and have her shoulders hunched, and that could also just tell if there's any deformalities while looking in the mirror. And if she notices any changes or tenderness in the breast, she should definitely call her PCP.